Good evening, and thank you guys for coming. We have this new service at N1 Wellness Medical Center, and we're going to be giving immunotherapy. Immunotherapy, otherwise known as allergy shots. And we're going to start this new therapy right away. And I wanted to open up this audience to get you guys in here to ask any questions that you may have about immunotherapy. And with me is my partner, Dr. Mink Cisse, and everyone knows me. I'm Donovan Christie. I'm the medical director here. And so I just want to open it up, and you guys can go ahead and ask about immunotherapy.
Well, what is immunotherapy, Dr. Christie?
Okay, well, immunotherapy is when we manipulate the immune system. We can either rev that immune system up by using immunomodulators or chemicals, or we could suppress the immune system. One of the things that we do routinely is to suppress the immune system when people have infections, because the body will produce inflammatory cells, which causes mucus production and swelling, and then that causes pain. So we normally give like cortisone shots, Decadron shots to suppress the immune system. With allergies, we're suppressing the immune system because we don't want it to respond to things that are common in the air, environmental allergies, or for things that people eat, like food, peanuts, milk, and stuff like that. The body is reacting to it, and then thus causing us pain or grief. So we want to suppress the immune system.
And how does it work, Dr. Christie?
Okay, the immune system, let's say for environmental allergens. Let's pick one. Pick an environmental allergen.
Pollen.
Pollen, okay. During pollen season, and pollen is actually not a big issue because it's only about a week or two, the season of pollen. But people who are sensitive to pollen, they will breathe that in. It creates what we call an allergen. That pollen itself is an allergen. The body's immune system, lymphocyte cells, are the first things that would react to it, picks it up, and then forms allergic antibodies. Once those allergic antibodies are formed, anytime you're exposed to that pollen again, those allergic antibodies are going to bind to certain cells that causes inflammatory mediators to come and causes swelling, itching, rash, abdominal pain, cramping, whatever. So it all has to do with a chemical reaction where we get sensitized to a allergen, and then on future, when you come in exposure to it again, it comes out. Okay? Any other questions for Dr. Cisse?
Well, I actually had another question. Like, for the lay person, when you're saying you're suppressing the immune system, they're like, well, why do I want to suppress my immune system? So how would you explain to a lay person, why is it called, why we're doing suppressing the immune system?
Well, an alternative term one could use is modifying the immune system.
Okay.
Because basically what you're doing is, you're tricking the body, okay, by injecting these allergens. So what the person's response is going to be producing antibodies to bind the allergens under normal circumstances if they did not get the allergy shot. So when you give the allergy shots, you're kind of tricking the person's immune system to produce a different kind of antibodies that instead of them causing allergic reaction, they're going to block the allergen. So a common question patients will normally ask, well, can I get rid of my allergies? Well, this is how it's going to happen, because when you modify the immune system like that, you're going to have an alternative reaction where you block the allergens instead of actually causing the allergic reaction. And
so you're actually dealing with it before the symptoms come?
Yes, absolutely. And in fact, that is a recommendation. I mean, studies have shown that the earlier you introduce immunotherapy, the better. Because you can actually prevent complications of allergies, and then you can actually prevent the patients from developing new allergies. I mean, responding to producing new allergens. In other words, you can actually prevent that in the near future if you start it early.
Yeah, that's very true. And one of the things that I'd like to piggyback and say is that, we have the allergy march, and that's why it's very important to get kids to recognize when kids as early as 3 years old, when we do these tests, we have positive immunocap or allergy tests for dust mites, for mold, for trees, for grass. When we get that, we need to treat that right away. Why? Because, like Dr. Cisse says, you're going to prevent a whole lifelong time of allergies, which then progresses to allergic rhinitis and then eventually asthma. So if you want to stop them from developing asthma or allergic rhinitis, you want to get it right then and there and start introducing them to these allergens in small portion by giving them allergy shots, so that you can harass or stop it from developing into asthma. Okay? Very important to do that.
Are there a certain amount of shots that are given at one time, or are they spread it out? How are they given?
You want to take that, or?
Well,
For
remember
the initial testing.
Well, it's you're picking specific allergens, I mean, to which the person is allergic to. So, and these are in vials, each allergen. So it really depends on what the person is.
It's patient
allergic to.
specific.
It's
It's patient specific. So some people, when we do the allergy panel, we'll see the whole thing light up. They'll have the test goes from 0 to 6, and 1 is the positive. We really try to highlight those patients that have 3 or more, and that tells you how much allergens, how much allergic antibody they actually have in them. The stronger the number, the higher the number, is the more IgE antibodies, that they have. And that's the antibody that's going to trigger the allergic response. So if they have, we're only going to immunize for outdoor allergens. So all the things that are in the environment, actually the inhalants. So dust mites, it's indoor, but it's an inhalant. You inhale it. Cockroach dander is an inhalant. Mole is an inhalant. So those are things that we're going to go strong for, and as well as the grass and the trees, the stuff that is outside. Once we get those, we put them all in a vial, and then it's diluted 1,000 to 10,000, 100-fold, and then it's introduced into the skin weekly. So so then the body gets used to it. It's so diluted to say, well, I'm not going to fight this, or it picks it up and then it converts it into a different form of antibody, a blocking antibody, and so then the body just doesn't react to it anymore. And that's how you can actually cure allergies. Can't cure it any other way. If you don't, then they're basically just going to have a lifelong of taking antihistamines and steroid shots and steroid inhalers and whatever. So this is what's going to cure it.
How long will it take until I'm cured?
Good question. That's also patient specific, because it really depends on how many allergens you have, number one. It also depends on how quick your body is going to produce those blocking antibodies. So on an average, though, the typical process is for a patient for the first 6 months to get a weekly shot, okay? Then after that, we can cut down to bi-weekly or monthly for about another 4 or 5 months. And then you can get what we call a maintenance dose, where you come in maybe once a month, not necessarily, but depends on if you're still having symptoms. And if you get those monthly shots, then eventually your body will eradicate the entire extra immunity or hypersensitivity, or the desensitization process will be completed in about 3 years.
Do you have to have symptoms? Is this part of a normal checkup? When y'all check the panel, or
Do I have to have some symptoms for you to do an allergy test?
Typically, yes. Most people who have allergies will come in with itchy eyes, runny nose, stuffy nose, cough, congestion, and some of them will break out into rashes. If it's an infant, a lot of them will have what we call eczema. You know what eczema is? You've heard of that? Yeah. Dry patches in the skin. And that's usually caused by the same IgE antibody that I'm talking about. But that's usually from food, typically. It's from milk. Cow milk protein is what normally causes that. And then as they get older, if that doesn't go away, wheat is a big culprit. Peanuts is another big culprit, and it causes really bad skin reactions. And these kids, they itch a lot, and they can scratch so much that you get different dark spots on the skin, light spots on the skin. And then when you put steroids on it, because that's what we know to do, we put steroids on it, it makes the skin even darker. In dark skinned people, it makes the skin light, and in light skinned people, it makes the skin dark. So there has to be a different way to treating atopic dermatitis than just getting topical steroids or steroids in general. So I think employing these allergy shots here at N1 is going to help us to follow our theme, which is to prevent disease and to keep people well. And this is just a way of us stopping it and preventing them from taking all the drugs on a regular basis and just getting their system to not react to it, because it is a hypersensitivity. I don't have allergies. Knock on wood. So I don't have to worry about eating certain things, or going into pollen, or I don't respond that way. So, but some people, there's a genetic predisposition for it, and then when it happens, you just have to help them out with these allergy shots, and it does work. It's been around for a long, long time.
Just to add to what Dr. Christie said, immunotherapy is more of a holistic kind of treatment, which is one of the philosophies of N1. Unlike using medications to treat the individual symptoms of allergic rhinitis, asthma, this is more or less treating the entire person, which is more of a holistic approach. So you do the immunotherapy, or you take the injection, and then you treat all these problems with just the shot alone, rather than treating the individual illnesses. So I think that's a very important piece of information to take note of.
Exactly.
Would
Any
that-
other questions?
Would
Yes.
that help angioedema?
Yes.
It would?
Yeah. Angioedema well, there's different types of angioedema. You could be missing a complement, which is a part of the immune system that's a hereditary angioedema. But regular angioedema from allergies, it'll definitely help. If you're getting angioedema from eating something, or from inhaling something, it will help that kind of angioedema, not the hereditary type, which is from missing a cofactor. It's called C1 missing. But it would definitely, angioedema is swelling of the skin, what people don't know. Some people just manifest their allergies with swelling, versus some people break out with rashes, or some people have dry spots. Some people get seborrheic spots. There's lots of different ways. And angioedema, or urticaria, we call it sometimes, that can come out just from emotion, different, or temperature changes. You can get it from that as well. It's not just from eating, but certain situations can bring it out.
Question.
Yes.
So, does this help with insect bites?
Definitely. That's one of the ways. That's one of the biggest things that they do to desensitize people. If someone has sensitivity to bee venom, you do allergy shots against that, and they do the same thing. They introduce that bee venom, small amounts, into them until they don't respond that way anymore. Penicillin, there's some certain antibiotics, people allergic to it. They can desensitize someone from reacting to penicillin by giving them small portions of it over a period of time. You can pretty much desensitize people from anything. It's the same process, but very good point for bee venom. Yeah. Yes, sir.
What are the side effects to immunotherapy?
Side effects.
Side effects.
Well, the side effects would probably be if you, when you start to getting the therapy, if you go too fast. If you're introducing 1/1000th of an antigen, and let's say you made a mistake and introduce 1/10 of that antigen, then you're rushing it. They're getting too strong a potion, and they can have a reaction to it. So the side effect is really a reaction, what we would call an anaphylactic reaction. Or it could be a local reaction, a small reaction, where they just get some swelling and urticaria, but it could get to the point where they actually could have difficulty breathing. And that's why allergy shots are usually done in the doctor's office, where patients are monitored for 30 minutes or more or less. And then they're sent home when we know that no reaction is going to take place. It should be done by a professional. Good point. Any other questions? Yes.
Once you start the allergy testing and start getting the shots, will it prevent the allergies from coming back, or is it something on a continuous basis?
Yeah, it will prevent those allergies that you've been desensitized from coming back.
Okay.
And what they've shown, and Dr. Cisse mentioned that once you've desensitized people from certain allergens, they won't develop other antigens. It prevents them. That person, when they develop allergies initially, they become this allergic person where they can just get allergies to anything. So you want to stop it so the body doesn't adopt that principle, if you want to say it that way. So, yeah, it definitely helps. Doctor?
What would be a reason why I would not be able to get allergy shots?
What would be a reason why you wouldn't be able to get it? Do you want to mention?
In other words, who
Contraindication.
who cannot get it. I think the contraindication will be, if somebody has, age is probably, I'm not sure about age, but I know here at An1, we decided not to administer it less than age 3. But in my clinical judgment, I would say, no less than 12 months, because you really want to wait till 12 months is really when you have adequate immune response. Mm-hmm. So in my clinical judgment, I would say any patient less than 12 months. But here at An1, I believe we decided to study that at 3 years, right?
Right. Yeah, 3 years. Traditionally, they had said 5, but then I think they realized now that since we're testing them down to as early as 3 for the environmental allergens, that 3 is a safe age to start. And it depends on the maturity of that kid. If the kid is going to fight every week to get a shot, Mom, no, I don't want to go there, every week, then you may want to delay it a little bit. But if they're mature enough to understand that this is going to make them better, I think it's a good age to start.
Or what about a pregnant woman?
Yeah, pregnancy is one of the contraindications. They don't recommend you doing allergy shots when someone is pregnant.
Are there any other medical conditions that would keep me from getting allergy shots?
Well, probably more if one is immunocompromised, I would say, because for a similar reason she mentioned pregnancy. That intuitively makes sense. If pregnancy is considered an sort of physiologically an
someone with HIV, probably,
HIV,
someone with
cancer,
renal disease, chronic renal disease, with cardiac disease, things like that. But most of the typical things, contraindications that you wouldn't want to challenge anyone's immune system, things like that. But for most of you guys, it's definitely something that you should look into.
One more question for you, doctors. Typically people who have allergies, they're constantly taking allergy medication. So with the kind of efficacy that you were telling me that's going to happen with this immunotherapy, are you saying that this could actually cut down the over-consumption of over-the-counter drugs, or the abuse of it?
Yeah, do you want me to answer that? Okay. Yeah, for sure. That's the reason why the insurance companies, I think, are pushing it, because they know that if you prevent a person from developing allergies, or they're not going to have to pay for all this prescription drugs, the Flonas's, the Nasonex, the Singulairs, the albuterols, and a lifelong. So if you get these kids before they turn 10, and you can desensitize them, you have a lifelong of drug costs that you're going to save. So it's definitely a preventative health maneuver strategy that should be implemented across the board.
I have one more question. If a patient's taking certain medicines, like antihistamines or blood pressure medicine, will it counteract the results of the test that's given?
Not the immunocap, not the blood test.
But the skin test, maybe?
We're going to talk about the skin test, how it would interact with that. Yeah.
Like antihistamines or blood pressure medicine, anything like that?
Well, not blood pressure medicine so much. There is, well, I guess alpha blockers. Yeah, alpha blockers, blood pressure medicine, some blood pressure medicine, beta blockers, and definitely antihistamines. If they're taking those drugs and you do a skin test, then the body's not going to respond to it, because you're blocking the response. So certain medications, if we were doing, we're not going to do that many skin tests here. We may get into it a little later, but not right now. We're just going to go with the blood test. The blood test is much more easy to do. You don't have to worry about introducing an allergen in there and causing a reaction versus giving the shot, which is in a much diluted form than giving it on the skin. So, yeah, those are the benefits of doing the blood test over the skin test. You don't have to worry about reactions, taking them off their medicines. You can do the blood test while they're on their medicines. Okay, so hopefully we've answered your questions, and that you guys will all be joining the line and and getting your immunocap so we can identify the specific allergens that you have. And as soon as the process after that, once we've identified the allergen, we basically send it off to the lab. We get the serum or the extract, the allergy extract here, and you come in on a weekly basis, and you're here for about 30 minutes. You get your shot, increasing doses of allergen each time, and that's it. You start feeling better, usually after the first 3 to 6 months. The symptoms can improve. Okay?
Thank you.
So thank you guys for coming, and thanks for enlightening us with these wonderful questions.
Thank you.